Dr. Adam Will. I'm a pediatrician with Adams Medical Group, which is part of Adams Health Network. I am actually board certified in both internal medicine and pediatrics, although my practice is primarily pediatrics. My office is in Bern, Indiana, formerly known as Swiss City Medical Center, founded by good old Dr. Judge. Practice whenever you walk in the front door on the right-hand side, you just look for all the kids' toys scattered about the waiting room, and you know you found my office. What I like about being a pediatrician specifically is I get to make kids feel better. I got a soft spot for kids. I have my own, 4 of them, and they're all old enough that I can't sit on the floor and play with cars and trucks with them anymore, so I can't remember the last time I had to change one of their diapers. But in the office, I get to see kids sometimes at their worst, try to help them feel better. Luckily, I get to see them at their best sometimes too for their well childs and hopefully keep them healthy. The community. Everyone cares about one another. It doesn't take much to find the support you need. It's a smaller community, and again, that's kind of a benefit. Everyone seems to be willing to help each other out. To be honest, Adams has been fantastic about getting me the support that I need to be a good pediatrician. When I was in medical school, I had a hard time deciding between did I want to take care of adults or did I want to take care of kids. Adult medicine, it's very evidence-based, it's oftentimes very by the numbers, and for someone who likes rules, it's really attractive. There are guidelines on just about everything that you can follow. Pediatrics, there's some of that, but I think it's really mostly about experience. Not my experience so much as the patient's experience. When my kids were little and they'd see the pediatrician, they were scared. They ran all over the office at times, put things in their mouth I really wish they wouldn't have. But I wanted them to have a good experience. I didn't want them to be scared. I wanted them to have fun. The doctor's office shouldn't be a scary place. Over my years of practice, I realized that that's what we're pretty good at. It's what I'm pretty good at, is hopefully giving kids a good reason to not be afraid of the doctor. Youngsters, it depends on the developmental stage, really. You know, a 4 to 6 month old infant, they're just happy to see everyone. It doesn't take a whole lot to gain that child's trust. A 12-month-old, where the stranger danger has kicked in, gotta give that kid some distance at first. Let them warm up to you, let them come to you. Sometimes that doesn't happen, sometimes the stranger danger is too strong. I get on their level. I'm not afraid to get down on the floor and play with a kid, push cars back and forth or toss a football back and forth to each other. I'll keep doing that as long as my knees let me. The age range of patients that I take care of, typically birth to, late teenage years. I do keep track of some adult patients who have congenital conditions that need a pediatrician's touch even as they grow older, especially those with developmental delays and autism disorder. The world's a little bit different to those kids even as they become adults. So I like to be able to provide that for them, and that's the main reason I keep up my internal medicine license, to be honest, just so I can keep taking care of them. I don't know that I have a specific age that I enjoy working with the most. And I mentioned that those 4 and 6 month old babies, they're super cute, they're super happy, they're getting drooly and slobbery and their hands are going to their mouths and sometimes their feet too. And again, they're just happy to see everyone. But they don't talk back to you. It's hard to know what's going on sometimes. The older kids, they can at least tell you how they're feeling. Again, I don't know if I have a favorite. I like to take care of all ages. I think I mentioned it earlier, I like the fact that I get to help kids feel better when they're not feeling well, when they're sick, when they're injured. I like the fact that I can help them be well, whether it's a well child visit or if I'm trying to help a kid out with their ADHD. I want them to do their best at school. I wanted my kids to do their best at school. I should expect the same for anyone else. I want them to do well. Probably helps that I never really grew up. I'm kind of a big kid at heart, so asked my wife about that. I just really never grown up, so I think I relate well to kids on that basis alone.